Okay, good afternoon, everybody. Welcome to the Thursday, June 24th edition of the COVID Weekly Situational Report, providing an update on the local COVID-19 situation. Happy to have you with us. Thank you for adjusting your schedules to this new Thursday format. Thank you to all of our elected officials who are here with us, and as always, grateful for our media partners who are joining us today. So what I would like to do is give us a moment to pause and acknowledge this beautiful day and place that we call home. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so let's, I'd like to invite our Board of Health Chair, Mayor Andy Mitchell, to start us off with some opening remarks. Please go ahead, Mayor Mitchell.
Thanks, Brittany. The battle against COVID-19 continues to go well. The community is working closely together. Cases are down, vaccinations are up, and the numbers of activities that are permitted have expanded. There is, however, one more tool that needs to be employed when dealing with vaccine, public health measures, and the ability to travel. It's patience. Our local vaccine rollout is going well. However, it's important to remember, medical experts have made it clear that getting a second dose is more important and remains safe than whatever brand you get. New appointments are continuously being offered. If you didn't get one today, you will soon. Immunity is not instantaneous. You need at least 14 days after your second dose to have maximum immunity. Patience is also required when it comes to public health measures. The safest activities are still those that occur outdoors, and that will remain largely the same in step 2. Wearing a mask and keeping a 2-meter distance continues to be an important tool in staying safe. COVID-19, including the Delta variant, continues to circulate. If you feel ill, stay home and get a test. Patience is likewise required when it comes to travel. We all have places to go and people to see. However, not just now. We haven't yet achieved herd immunity. We need to be careful what is introduced from elsewhere. Canada leads most of the world in first doses. However, other areas continue to struggle with controlling the virus. New guidelines are coming. They need to be cautious and they need to be right. Those who know me well may find that I am a surprising messenger in calling for patience. But folks, it is a trait we all need to employ over the next month. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, great message indeed. Okay, let's hear from Dr. Salvaterra with an update on the latest statistics regarding the local COVID-19 situation. Please go ahead, Dr. Salvaterra.
Thanks, Brittany. I think we're all learning to be more patient. Thank you, Andy. So we continue to see a few cases of COVID being reported each day here in Peterborough, but currently are only reporting 17 active cases in our region. So it's great to see that number under 20. The number of close contacts is not decreasing at that same rate. However, and so it does indicate that some of our cases are still engaged in high contact situations, but presently we are following 76 close contacts locally. We continue to see both the Alpha and the Delta variants circulating here in our community. Next slide, please. When we look at our weekly case counts, you can see that they are continuing to decline. The rate of decline has been slow over the past 3 weeks, but certainly the trend is in the right direction. Next slide, please. This is the great news that we have to share, is that we continue to have no active case COVID outbreaks in our community. We have not declared a new COVID outbreak since May the 28th. So let's hope we can keep this going. Next slide, please. So starting to the right of the slide, you can see our weekly case incidence rate for last week ending in June 22nd as 11 cases per 100,000. This is lower than the case incidence rate that we reported on June 14th when we were at 16 cases per 100,000. The line graph here on this slide is a little different than the ones we've been sharing previously, but it does show you data from our neighboring health units, and it compares the number of new daily cases reported over the last 14 days. Peterborough is the purple line, and you can see that we continue to fluctuate between 1 to 4 new cases per day, but it's great to see all of our neighbors reporting low daily case counts, including Durham. Next slide, please. On this slide, we're showing you the wastewater sampling results for Peterborough, the city, since the beginning of the testing back in January. And what this shows you is that we continue to see a very low signal being detected in the last few weeks. We also have begun to test wastewater in Cavan Monaghan, and we hope to have some data to share with you soon from there. Next slide, please. Let's move on to vaccination. And here we show the data for, as for the end of clinics yesterday. So you'll see that in orange, well, first of all, before we get to the pie charts, the numbers across the top, you'll see they continue to climb significantly. It's interesting to note that since our last briefing, more people received second doses, which is in green, than first doses. Currently, 96,708 of our local residents have received their first dose, and that's about 3,500 more than we reported 10 days ago. There are now 30,649 residents who are fully immunized, and that is 14,000 more than we reported last time. In terms of our vaccination rates, and you can see here in the pie charts that we have on the left one, nearly 77% of our local adults aged 18 and over have received at least 1 dose. And in the right pie chart, which shows us our youth ages 12 to 17, you can see that 60% of them have received at least 1 dose. And that's a 20% jump from just 10 days ago. We'll take a closer look now at the age groups. And here in this bar graph, you can see the purple shows people with 1 dose, the green shows people with 2 doses. If you look at the green, you can see that our population of older adults over 60 years of age and older have the highest rates of second doses, which is great to see because they are more vulnerable to serious disease with COVID-19. However, we still would like to see more of our younger adults immunized with both their first and second doses in order to help stop the spread of COVID-19. Next week, the province will allow everyone who is 18 or over to book a second dose, and they can be administered as early as 28 days apart. So I do encourage everyone in Peterborough to book either their first or their second dose. I understand we do have lots of availability today for people looking to book those appointments. So I would like to make a few remarks, and I'm going to start with immunization. I know much of the guidance on immunization has changed as the science has evolved. And I know some residents were a little surprised to learn this week that our clinics were offering them Moderna when they may have been expecting Pfizer. This was due to the unexpected delay of the provincial Pfizer shipments. However, I would like to reassure local residents that mixing Pfizer and Moderna vaccines is both safe and effective. I like to compare it to drinking either Coke or Pepsi, which are both brand names for two very similar cola drinks. Both Moderna and Pfizer are mRNA vaccines that use the same technology and work the same way to help our bodies mount an immune response against COVID-19. Mixing vaccine brands is a common practice in public health. The only vaccine brand that remains authorized for use, though, is Pfizer. So as vaccine supplies change, this allows us to adjust the mRNA vaccines available at our clinics to ensure that we have enough Pfizer for our youth. We are running clinics in the county this week. We will be in Buckhorn, Apsley, and Norwood. Also on Saturday, June 26th, in the city at the Evinrude Centre, we are inviting any youth aged 12 to 17 and their families to come on down for their first doses between noon and 3 p.m. It's a walk-in clinic. It's for first doses only. No appointment is necessary. You just need to bring your health card and ID. And for any of our clinics, the Ontario government has announced just this week a program to provide rides to vaccination appointments for seniors and those with disabilities. This program is a partnership with the Ontario Community Support Association. And if you go to their website, which is ocsa.on.ca, you can book this online. They ask for 48 hours notice before your appointment. And this is a great service that I encourage residents to take advantage of if they need it. Next slide, please. Now, moving on to other big news announced by the province this morning, Ontario will move to step 2 of its reopening plan on June 30th, a few days earlier than planned. While many indicators are looking good, and it's exciting to see us shift to step 2, I must say that locally in some workplaces, we are not seeing the levels of compliance we'd like to ensure that all workers are adequately protected. In particular, I'd like to remind businesses and organizations that PPE is required whenever physical distancing of 2 meters cannot be maintained. This means that eye protection must be worn in addition to a mask because we know how much more transmissible the Delta virus is. If a positive case is identified and we learn that a contact was not wearing eye protection, they will be considered a high-risk exposure and will be mandated to isolate for 14 days unless they were fully immunized at the time. So it's best to take that extra precaution and protect the eyes as well as the nose and mouth because they are all virus entry points. I would also like to remind everyone that COVID-19 symptoms at the start are not always severe, and so you should get tested even if you have mild symptoms like a headache and sore throat and runny nose. Please get tested as soon as possible should any of these symptoms appear, and remember to self-isolate until you receive your results. We are still seeing cases who continue to work or socialize even when symptomatic. So please don't assume it's just your allergies. On the topic of self-isolation, we have updated our Section 22 class order with revised instructions that took effect this morning. Our class order requires anyone who is a confirmed or probable case or a close contact of a case or anyone experiencing symptoms of COVID-19 to self-isolate to prevent COVID-19 transmission. That's not new. But the Section 22 order also requires individuals to disclose requested information to Peterborough Public Health investigators to facilitate case and contact management, which may include the names and contact information for close contacts during an individual's period of communicability. The order was also updated to account for those who may be vaccinated. And remember, you are not considered fully immunized until 2 weeks after your second dose. And for older adults with slower immune systems, it can actually take up to 4 weeks to be fully protected. And finally, I would like to offer a public health perspective on the important milestones and celebrations that are typically happening this time of year. For our grade 8 and high school graduates, this is an exciting time to recognize your amazing accomplishments, especially this year. However, we are not yet in step 2, so there can be no indoor gatherings. And outdoor gatherings can only be for 10 people, assuming that 2 meters of physical distance can be maintained. I encourage you to consider drive-by graduations and other safe and creative ways to celebrate virtually. And for Canada Day, this for many will be a muted celebration this year as we continue to grapple with this country's difficult legacy of Indigenous residential schools. Please remember that social gathering limits apply if you choose to be with others. It will be a maximum of 25 outdoors and 10 indoors, and there can be no public gatherings organized by municipalities. So I'll end with that and turn it back over to you, Brittany.
Great, thank you very much, Dr. Salvatierra. Okay, joining us today, we have MP Maryam Monsef and our municipal representatives with Mayor Therrien and Warden Jones. So let's start with MP Monsef, and please take it away. Go ahead, Maryam.
Thank you so much, Brittany. My internet connection's giving me a hard time today. I hope you can hear me.
Yeah, can hear you fine.
Hello, colleagues. Bonjour, Anin, salam alaikum. Many thanks to you, Brittany, to Dr. Salvatierra, and to Chair Mitchell for your leadership and for getting us to 77% vaccinated with first dose, and for all the ways you've had to pivot and respond to the changing nature of this pandemic. If we're in good shape, leading up to Canada Day, 16 months after the pandemic was declared, it's because of professionals like you. And we appreciate you for that care and for your hard work. And we sure hope you get a break sometime this summer. I was listening to Dr. Salvatierra, and my niece graduates tomorrow. I get to be part of a drive-by ceremony, and I've never been to one of those, but it's still a rite of passage for so many kids, so many parents and their loved ones. And all of that is happening in the backdrop of more and more bodies of little kids being unearthed. And as we lead up to Canada Day, as we put the pandemic behind us, we come face to face once again with the realities of this great country and facing the true history of this land. The horrific findings serve as a stark reminder that Indigenous people have and continue to endure systemic oppression, inequities, and discrimination. As a government, we will continue to work with Indigenous communities to find their missing children and to do what needs to be done to bring them home. Of course, our prayers are with communities and with those who are being triggered. I was part of the ceremony and the vigil here earlier last week. It was done safely. People wore masks. We stayed outdoors. I'd like to add that there's a 24-hour national residential school crisis line, which is available to provide support to all survivors and all those affected. That number is 1-866-925-4419. On the vaccine update, we continue to see millions of vaccine doses arrive each week and every week. And we are on schedule to receive 50 million doses being delivered cumulatively by the end of next week, and more than 65 million cumulatively by the end of July. This is enough doses to vaccinate every single Canadian. As you remember, in August 2020, our government announced $126 million to design, construct, and commission, as well as certify a new biologics manufacturing center at the National Research Council facilities in Montreal. You may also recall that earlier this week, we reached an agreement with Novavax to produce their COVID-19 vaccine at this facility on Canadian soil. Construction is now complete, ahead of schedule, and once in production, the facility will have the capacity to produce up to 24 million doses of the Novavax vaccine each year. This will be in addition to the 30 million doses we've secured from Pfizer for 2022 and 2023, with an option to purchase the same amount in 2024. I mention all this to emphasize that as the need for booster shots rise in the coming years, Canada and Canadians will be well positioned to provide them, to receive those doses as soon as they may be needed. On vaccine dose mixing, I do want to take a moment to reiterate what Dr. Salvaterra said, and the Pepsi and Coke analogy, doctor, will probably get people talking, and I look forward to people sending you emails about Pepsi or Coke, but your analogy is accurate, and as you said, whether it's the first dose that is Pfizer or Moderna or AstraZeneca, when it's time for your second dose of an mRNA vaccine, take whichever one's available to you. That's what I'll be doing. I got my first vaccine on June 10th, a date I'll never forget. And thank you, Dr. Salvaterra, for giving all of us the green light to go ahead 28 days later and book the second shot. All the evidence shows that mixing vaccines is completely safe and effective. And if you haven't gotten your vaccine yet, please do so. We're seeing what's happening with the Delta variant among unvaccinated populations in the UK. We also see this happening in states like Arkansas and Utah, where comparably low vaccination rates are leading to a greater spread of the Delta variant. And vaccines don't just protect you, they protect those who are unable to get vaccinated, those who are immune compromised, and our children under the age of 12. So if you haven't, please get your vaccine. Thank you so much to our frontline workers and the team at Public Health. I'll hand it back to you now, Brittany.
Great, thank you so much, MP Monsef, and thank you for your words today. All right, let's hear from Mayor Therrien from the city of Peterborough. And if your camera's working, I'm happy to put you up on the screen. Go ahead.
Hi, Brittany. Thank you very much. Just a couple of remarks. We know that most people in the community have been following the public health measures when they've been outside enjoying city parks and trails. But we are aware that there have been some reports of larger gatherings. So the city continues to work with public health and the Peterborough Police Services to ensure that there's higher awareness about public health measures and compliance with the provincial regulations. So we just need everybody to hang in a little bit longer. I know the weather is nice and people want to be outside. So if you're getting outside this weekend, remember that the outdoor social gatherings are limited to up to 10 people while we're still in step 1 of the provincial roadmap to reopen, and to stay at least 2 meters from anyone who isn't in your household, and to wear a mask if physical distancing will be challenging, such as on our busy and beautiful trails. So thank you to everybody that's using our community spaces responsibly. Be safe, be well, and I'll turn it back over to you, Brittany. Thank you.
Thank you, Mayor Therrien. Okay, so let's hear from County Warden Jones to bring us the county perspective. Please go ahead, Warden Jones.
Okay, thank you very much, Brittany. And you know, I got to be very honest and say how impressed I am about everyone working together so wonderfully through all this. You know, the city, the county, the health unit, just everybody kind of together on one page. And I really do want to shout out all of our frontline workers, the city and the county, by the way. I'm just letting you in on a bit of a tip. We're going to be doing something very special to say a very special thank you to all the frontline workers, and there are a pile of them. So Diane and I should be, I hope, announcing that very soon. It's the least we can do, and we really do have to pat a lot of people on the back for getting us through this. Our clinics in Norwood and Buckhorn and Apsley have been doing great. I think this is a wonderful service for our county residents, and we certainly thank you for including the county in these clinics. It all helps getting everyone from a huge area vaccinated. Our staff at the county are also helping the health unit at the clinics and in other ways to get us through this huge job that we've undertaken, and we're very proud of them for that. So I can't say a whole lot more than everyone else has said. We sure have been in this together. The light is definitely at the end of the tunnel. Let's hold on. Let's keep doing what we're supposed to do. And you know, I said this at a staff meeting the other day, and it rings true with me. There's a Gordon Lightfoot song, and it's called Now and Then. And, you know, we can be gloomy and get down in the dumps and how terrible all this has been, and oh my goodness. But now and then, maybe we should think about the good times and the good things that we have, and how thankful we all should be to be at the position we're in right now. So now and then, let's think about the good things. Thanks, everybody. Let's keep working together.
Thank you very much, Warden Jones. Absolutely. Lots to be grateful for as well. Okay, so now I will turn it over to our media guests, and we'll start with questions for Dr. Salvaterra. Let's start with Matt Latour from Freak and Oldies Radio. If you've got some questions, go ahead.
Dr. Salvaterra. My first one is, I know a lot of people, as we look at step 2 coming up next Wednesday, a lot of people are kind of looking at the vaccination numbers, and we've hit the threshold for step 3. Do you think we could see that accelerated to be even sooner when the time does come?
I don't have a crystal ball, Matt. I mean, I hope so. I hope so. But I do think the 3 weeks is a very cautious and appropriate timing, because it does allow time not only for the incubation period of 14 days, but it also builds in some additional time for the delay in reporting, because typically people who get sick need go and get tested, and there's a 48-hour delay until they get their result. So 3 weeks builds enough time in to catch everyone before moving on to the next step. So I like the 3 weeks. Might it be shorter? We can hope for that. And I'll keep my fingers crossed.
Perfect. And my next question has to do with some of the wording when it comes to step 2 about outdoor sports, where it says no specified limit on the number of people or teams participating, but then it says with restrictions. So where does that come into play?
Well, we may have a better answer for you once we've had a chance to review the regulations. They were just released this morning, Matt, and I know my team and I are still going through them. So what we'll put that, we'll take note of that question, and we'll get back to you on that one.
That would be wonderful. Thank you. That's it for me.
Okay, thank you very much, Matt. And yes, as soon as we have finalized the guidance and gone through the regulations, we'll be updating our website with all of that information. Okay, let's hear from Bill Hodgsons from My Kawartha and Peterborough this week. Go ahead, Bill, if you've got some questions.
Yeah, a couple of things for Dr. Salvaterra. You mentioned we've both alpha and delta variants here. Can you offer a ratio? Is it are there more delta than alpha right now, or more alpha than delta, or?
Yeah, it's a great question, Bill, but not one that we can answer. And that's because we have a screening test right now that all cases undergo. And so we can screen right away whether it's an alpha or not. But to actually identify the delta, you need to take those alpha negative results and you need to sequence them. And genomic sequencing takes about 2 weeks. And up until last Monday, the Public Health Ontario lab was just doing a 50% sample. So they weren't screening all of them. They were just choosing 50%. So we aren't able to actually quantify and compare the number of alpha to the number of delta. But we do know that we have both.
Okay, on a different note now, it's my understanding that the ability to get COVID from touching things isn't as big a concern now as it was thought to be at the beginning. In the last couple of weeks, we're hearing a lot of people wanting to host or attend yard sales. Actually, from a bylaw perspective, can I get in trouble for attending or hosting a yard sale? And what are the risks, I guess, health-wise as well?
I think I can answer the risks. As far as the bylaw question, I'm not sure if there's someone on the call today that can do that. I'm getting a little bit of echo, Brittany. I don't know if others are hearing it. But as far as the risk, Bill, you're right in that fomites, so surfaces, don't seem to play as great a role as we thought they might back 16 months ago. We understand now that most of the transmission is either through droplet or even airborne. So the greatest protection is keeping that distance. Sorry, I'm hearing some echo. So keeping that distance and that applies even when you're outdoors. It certainly is safer outdoors because of the ventilation, but it's not foolproof. As far as yard sales and bylaws, I'm wondering, Brittany, do we have anyone on the call today that can answer that?
We do have some city reps. My apologies for the echo. Oh, goodness. I wonder if Brendan Wedley from the city might know something about this, or perhaps can follow up if there's more information.
Thanks, Brittany. I can follow up with Bill on that one.
Okay. And I just have one more question that I've seen asked a few times, and I'm still kind of confused at the answer. Mm-hmm. And I hope this isn't confusing, but let's say I have two doses and I passed my 2 weeks. I have a friend that has 2 doses and passes 2 weeks, and I have another friend who is deciding right now not to get a vaccine. Am I at any more risk at being in front of one over the other?
Well, you have to remember, Bill, that the vaccine does not give you 100% protection. It's about, even at its best, it's about 90% in protection. And we still are collecting evidence to determine whether or not people who are vaccinated and get infected, whether or not they're able to pass that on, even though they themselves may not get sick. So we don't have all of the evidence in yet. So we are asking that people who are immunized, I mean, I think you'll see the guidance that we expect soon, giving it advice for people that it will only include people who are fully immunized interacting with others who are fully immunized. So there will be a difference. Does that answer your question?
I think it does. Yeah. Okay. Thank you very much. I'm good for now.
Great. Okay. Thank you, Bill. All right. So I think I see Trent Radio on the line. So Rob, if you've got some questions, please go ahead. And I should have mentioned that we also are grateful to have representatives from our enforcement partners as well, from Peterborough Police Service and OPP. So if there are questions for them, you can go ahead. But let's start with Dr. Salvatierra. Rob.
Hi, thanks, Brittany. I just have one question. I just missed some details we were going through about the youth clinic. I got that it was between noon and 3 p.m., but realized I didn't get where it was or the date. So that's not the most helpful. So if you could just remind me of those, that would be wonderful.
Certainly. I was speaking about the Evinrude Center, and that's going to be this Saturday. So it's June 26th. Evinrude, anytime between noon and 3. Youth and their families can walk in. They can drop in for their vaccinations. They don't need an appointment. They just need to bring a health card and some ID.
And it's a first dose only clinic, if I can just add that.
Thank you. Yes.
Okay, perfect. Yeah, that is much more useful information than what I got the first time around. Thank you very much. I think that's everything from me. Thanks.
If I may, Brittany, I want to try again to answer Bill's question because I think I didn't get it the first time. So Bill, let me try again. The clinical trials that have been done on the vaccines only measure endpoints such as symptomatic disease, hospitalization, and death. They didn't actually test people who weren't symptomatic to see whether or not they still got infected and perhaps were asymptomatic because of the vaccine, but were still able to pass the virus on to others. So that is an unanswered question. And for that reason, we still are not able to give, evidence-based advice about the risks of getting close to people who are not immunized and potentially at higher risk of being infected. Did I get it that time, Bill?
Yeah. Thank you. That's much clearer for me.
Okay. Thanks for giving me a second try.
Thank you, Dr. Salvatierra, and thank you, Bill. Okay, Jessica Nisnik is with us from Global. So if you have some questions for our speakers, please go ahead, Jessica.
Thank you, Brittany. Just really one for Dr. Salvatierra. When we enter step 2, do you see yourself implementing any further measures that the province is putting out measures? Do you see yourself implementing any further measures because you have in the past?
That's a good question, Jessica. I mean, I'm still reading the regulations. I downloaded them earlier this morning and I'm going through them, and I know Julie Ingram and her team have gone through them. So we will plan to discuss them to see whether or not we feel they're appropriate and whether or not there are any potential gaps for us here in Peterborough. And if there are, we can, as you know, issue instructions instructions. So I don't know the answer to your question yet.
That's very fair. Thank you, Dr. Salvatierra.
Okay, thank you, Jessica. Let's hear from Paul Rellinger from Kawartha Now. Go ahead, Paul.
Thanks so much, Brittany, for Dr. Salvatierra. First of all, I'm not missing the yard sales. I just buy all the stuff back that I sold last year. So it's a vicious cycle. I wanted to ask about, since we last had a briefing, there's been a lot of talk and mixed messages around AstraZeneca. And I just wanted to get your thoughts on it and maybe a reassurance, because as I understand it, people who got 2 doses of AstraZeneca are certainly protected. But then the government came out and said, well, if you got your first dose of AstraZeneca, it's probably better to get Pfizer or Moderna for your second dose. So a lot of people have that second dose. They can't get a third dose. So what do you say to them?
I say if you've had 2 doses of AstraZeneca, you're good. And you don't need a third dose of anything right now. So you're right, Paul. 2 doses of AstraZeneca are good, is good protection. And the messaging on AstraZeneca has changed a number of times. So I have to apologize to everyone. It is confusing. We currently do have people in Peterborough who had their first dose of AstraZeneca who are now getting second doses. And we are offering them a choice. They can choose to get AstraZeneca as a second dose, or they can choose to get an mRNA vaccine. And it's interesting to see that a number of people are choosing to stick to AstraZeneca, and a number of them are switching over to Moderna. So I think both are good choices. We certainly know that the mRNA vaccines do not carry the same risk of that very rare immune clotting disorder. And for that reason, because there is a safer choice, we are, in fact, NACI has recommended that the preferred second dose be an mRNA vaccine. But that said, people can make an informed decision. And so they can choose to be immunized as soon as 8 weeks later if they had AstraZeneca, or they can wait till 12 weeks. And then at the time of immunization, they can choose between AstraZeneca or an mRNA vaccine. Lots of choice, no wrong decisions.
Terrific. Thank you for clearing that up. And just one more thing. Throughout the course of the pandemic, we've had moments where numbers came down. It looked like we were on a good path. I want to talk about this period we're in now compared to, say, maybe late last summer, where numbers were coming down. Then, of course, they spiked after that. How do you compare your confidence level now compared to that time last fall? Like, are you? I know you say many times you don't have a crystal ball, but 17 active cases right now. All the numbers are trending well. I take it you're more confident that this trend is going to stick than the one we had last fall.
I say the game changer, Paul, between last summer and this summer are the variants. And last summer we had wild coronavirus strain circulating. It was before we had the Alpha variant, before we had the Delta. The Alpha variant was 60% more transmissible than the wild strain, and the Delta variant is 60% more transmissible than the Alpha variant. So it is much more infectious now. The virus is mutated and it's much more infectious now than it was last summer. So I think that's the big difference. The one thing that's going to stop a fourth wave from happening is second doses in arms. And that's because we know from the UK that 1 dose alone is less effective against the Delta variant, that in order to get good protection against the Delta, you need 2 doses, not 1. Whereas 1 would give you reasonable protection against Alpha, 1 against Delta, not enough. So I think the difference that we really are depending on, Paul, is that more and more people are immunized with their second doses. And as I said earlier, we do have appointments open right now. If people go online, there is availability to get that second dose booked if you had your first dose May 9th or earlier. And then as of next week, it's going to open right up, and everyone who's 28 days or more from their first dose can get that second dose.
Terrific, Dr. Salvatierra. Thanks so much, and thank you, Brittany.
Thank you, Paul. Okay, so Joelle Kovach is here with us from the Peterborough Examiner. So if you've got questions, please go ahead, Joelle.
Okay, thank you. Dr. Salvatierra, is anybody turning their noses up at Moderna?
Yes, well, we had a few, certainly earlier this week. So what happened was we learned Saturday that the Monday delivery of Pfizer was going to be delayed till Wednesday or Thursday. And we had large clinics booked. And so we had to do a very last minute switch at one of our large clinics on Monday, and we substituted the Moderna. And we did have some people who, when they learned that they weren't getting their Pfizer, were quite upset. Many of them decided to go ahead with the Moderna, but we had a few people choose not to. Which is why on the next day we did some messaging, and I know that message is being amplified through social media and even advertisement to try and provide the residents of Peterborough with the information they need to know that it's both safe and effective to switch it up a bit and get a different mRNA for the second dose. So I think we're seeing less of that distress in these last few days, and perhaps it's because people now have been forewarned that, you know, when you go for your second dose, don't be surprised if it isn't the same as your first. And I think that alone is helping people prepare and for that potential scenario where they're not getting what they thought they were.
Do you think, what is going on with that preference? I mean, you've been very clear that they're kind of the same. I don't quite understand why some people want Pfizer instead of Moderna.
Joelle, I don't understand either. When you look at these two vaccines from an effectiveness profile, they're equally effective, you know, high, like 94, 95% effective against wild strain COVID-19. When you look at their safety profiles, it's identical. I'm certainly following up all of the reported adverse events following immunization. And I can tell you that even just from our local experience here in Peterborough, these vaccines are behaving like they are the same vaccine. So I don't understand where it's coming from. And frankly, I hope it ends, because we as public health, we are constantly interchanging brand name vaccines. So when you go for an MMR, let's say, which is measles, mumps, or rubella, let's say you're taking your child for their second dose, you don't know what brand it is. You just know it's measles, mumps, and rubella. Similarly for pertussis, or, you know, for polio, we don't brand name it. And so I think similarly with the COVID-19 vaccine, all you need is a messenger RNA vaccine. You don't need to brand name it.
Okay, that's really great. Thank you very much. If the mayor is still there, I would really like to know whether she can add any detail about these larger gatherings that the city has heard about. Can you say whether those are in city parks? What's going on?
I think she had to step off, Joelle, but perhaps Brendan can follow up with you on that.
Okay,
Thanks.
maybe police will have something to say about that. Sorry, Brendan, I didn't hear you.
No, I was just jumping in to say I'd be happy to follow up. I don't have any details on numbers or locations, but that there were some complaints about larger gatherings in the city parks. Thank you.
Okay, thank you. Perhaps one of our Peterborough Police representatives, John Lyons, perhaps you've got some comments to make?
Hi, thanks, Brittany. Yeah, we did have a report of a gathering at Beavermead last Sunday afternoon. Police attended, and they did locate a group of people excuse me, within the park itself. The event organizer was spoken to regarding the group and requested that they distance themselves from each other. It was discretion used on behalf of the officer to try and educate as well about the fact that in step 1, that it didn't allow for gatherings of approximately, I think, 150 people was what I think the officer had guesstimated the group to be at. So it came down to that discretion of educating about the step 1, 2, and 3, and some of the parameters in those steps as to what the number of gatherings were. As we transition further, I think that there is going to be some confusion for people to understand that it isn't just wide open, that there are necessary guidelines there so that we are doing it effectively, efficiently, and in a healthy way. But that was the only gathering I'm aware of that occurred this past weekend.
Okay, were these not the same people who were organizing the anti-lockdown protests downtown?
Not to my knowledge, no. I think this was a different group. So it wasn't a protest group. This was actually a group of people that were familiar with each other and had gone there to essentially have a food and just be outdoors.
Okay, was there an anti-lockdown protest this week?
A small gathering is what I was told, but again, it wasn't of anything of consequence, and there was no charges laid.
Okay, no charges at Beavermead either. Okay, that's about all I have then. Thanks.
Thank you.
Great. Thank you, Joelle, and thank you, Inspector Lyons. Okay, well, I think that brings us to a close. And what I would just like to do is remind everybody about our new schedule for these media briefings. So next Thursday is Canada Day. We have adjusted the media briefing to take place on Wednesday, June 30th at 2 p.m. So not noon, but 2 p.m. Hopefully you've all received the meeting invitation or you've got the link from the media advisory. So we look forward to seeing you back here then, and then we will continue on our Thursday schedule for as long as necessary. All right, thank you all. Have a great rest of your week and good weekend. Enjoy the sun out there and stay safe. Thank you.
Thanks, Brittany.
Thank you,
Thanks.
Brittany.
Brittany, I had a question, a quick one.
Oh, sure. Go ahead.
Is that link that we used today going to be good for next Wednesday as well?
Yes, it is. And I'll send out another advisory just with the same link as well for the 30th.
Okay, sorry to jump in there. Thank you.
No worries. Okay, thanks, Paul. Take care.